Have you ever woken up with sudden and intense pain in your big toe or another joint? If so, you may have experienced gout. Today I will talk about one of the most common types of arthritis, which is gout. Gout is a painful condition that affects millions of people worldwide. In this video, I will review 5 signs of gout you need to know about, including some lesser known symptoms. Plus, we will dive deep in what can precipitate a gout attack. So let's get started.
Rheumatologistoncall.com.
I want to share with you a story of one of my patients. One morning, Mr. Colin called my office for an urgent appointment. He told my assistant that he needed to be seen right away as he was in excruciating pain. He had swelling in his right foot and he could not walk. He could not even stand the sheets over his foot. When he came to my office, Mr. Colin hopped on one foot. He had a swollen red foot and he could not even stand to be examined. A few days before he came to me, he attended a party where he drank some alcohol and ate some shellfish. At this point, I was almost sure I knew what he was experiencing, but watch until the end to find out what happened to Mr. Colin. What is gout? Gout is a very common form of inflammatory arthritis, which is caused by the buildup of uric acid crystals in your joints. It will affect males earlier in life, but after menopause, females are also affected. Gout is very rare in children. The uric acid crystals can cause inflammation, redness, and pain in certain situations. While most patients experience gout in the big toe, some patients will get gout in the hands, in the knees, in the ankles, and even the lower back, like the sacroiliac joints. So not always gout starts in the big toe. You can have one joint affected, or you can have multiple joints at the same time. And you can also have migratory pain, meaning that one joint will hurt this week, and then a few days or weeks after, you will have another joint affected, and in another few days, another joint affected. Now let's talk about 5 signs of gout that you need to be aware of. Podagra. Podagra refers to the gout that involves the big toe. If you have gout in the big toes, you will experience redness, pain, swelling, and intense pain. Most of my patients say that it's the worst pain in their life, worse than giving birth. Most patients go to bed fine and they wake up in severe pain the following day. The pain may last for several days and can go away on its own, but it can also respond to anti-inflammatory medication. Before seeing the doctor, most patients will try something for pain, which is most often over-the-counter anti-inflammatory medication like naproxen and ibuprofen. Ankles, knees, elbows, wrists, and fingers can all be involved. Most of the time, one joint at a time is affected, but as I mentioned, multiple joints at a time or a migratory type of pain can happen. The joints will be red, swollen, and very painful. I cannot emphasize that. Patients can be tearful due to severe pain. Tophi. Tophi are small, white, and yellowish lumps that can develop under your skin. They are caused by the accumulation of these uric acid crystals in your joints, but it can also be a sign of advanced gout. When I have a patient with gout, I always examine the ears, the elbows, and hands, as these are the common areas for tophi. Tophi do not hurt, but they can damage your joints, they can open up the skin in the areas where they are located, and they can increase the risk for infections. There are patients with huge tophi that can cause severe destruction of the joints and can affect the mobility of those joints. Kidney stones. So kidney stones are caused by the buildup of the uric acid crystals in your kidneys. Once the kidney stones are big enough and they start to mobilize, they can cause severe pain on your side or on the back, together with nausea and vomiting. kidney disease, or chronic nephropathy. This is a way to call a kidney disease that is caused by uric acid deposits in the kidneys that will create inflammation and eventually will lead to kidney damage. You must know that gout is often linked to other medical conditions like obesity, high blood pressure, and diabetes. Some medications like diuretics or water pills, low-dose aspirin, medications to decrease your blood pressure, and some chemotherapy drugs can also increase the uric acid and precipitate a gout attack. What happened to Mr. Colin? Mr. Colin was a gentleman that was slightly overweight, and he was often eating in restaurants while he was meeting with his clients. He preferred a beef, a hamburger, and he also had a whiskey every night before dinner. His father also had gout. He was familiar with this disease. After his episode of gout, we decided to get some labs, and then I started him on treatment. First on steroids, then with a medication that will lower his uric acid. After a few days on steroids, he called back that his swelling is down, his foot was no longer red and hot, and he was able to put weight on that foot. He called me his angel for helping him with that awful pain. In conclusion, gout is a very painful type of arthritis that is caused by the buildup of uric acid crystals in your joints. The 5 signs of gout will include podagra, other joints involvement, tophi, kidney stones, and kidney disease. If you are experiencing any of these symptoms, you should call a rheumatologist to get evaluated immediately. It is better to prevent gout attacks than experience one. If you don't believe me, ask someone that had a gout attack. And remember to leave me a comment and share your gout story with me. Thank you, and I will see you soon.
Rheumatologistoncall.com.